Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Our topic today about the blood vessels and lymphatic drain of the head and neck. Let us start with the common carotid artery. We have two common carotid arteries. The right, which originate from the brachiocephalic trunk. As you know, we have arch of aorta that originate from the heart. This arch of aorta has three branches from the right to the left: brachiocephalic trunk, left common carotid, and left subclavian. So, the common carotid artery, the left one is the direct branch from the arch of the aorta. The right originates from the brachiocephalic trunk. From its name, common carotid artery. This common divided into two arteries, internal and external carotid artery. At the level of the upper border of the thyroid cartilage or the disc between the third and fourth cervical vertebrae. Internal carotid artery pass directly into the neck and has no branch in the neck. It supplies the brain. External carotid artery supplies the structure in the head and neck. The branches of the external carotid artery include ascending pharyngeal artery, occipital artery, posterior auricular artery, superior thyroid artery, lingual artery, facial artery, and two terminal branches, which are maxillary artery and superficial temporal artery. To memorize this branch, we divided the branches into anterior branch, posterior branch, medial branch, and terminal branch. The anterior branch includes three arteries. In order from proximal to distal include superior thyroid artery, lingual artery, facial artery. These are three anterior branches. The medial branch is the only one known as ascending pharyngeal artery. The posterior branch includes two branches, occipital artery and posterior auricular artery. The two terminal branches are maxillary artery and superficial temporal artery. Again, the branches divided into anterior branches, posterior branches, medial branch, only one, and two terminal branch. The two terminal branch are maxillary artery and superficial temporal artery. Maxillary artery, we describe this artery by details. Superficial temporal artery, this superficial temporal artery supplies the temporal region. Posterior auricular artery, from its name, supplies the auricle and the scalp. Occipital artery supplies the posterior part of the scalp. There are two posterior branch. The medial branch, it is named ascending pharyngeal artery. It supplies the muscle, the pharynx and the prevertebral muscle. The anterior branch are three in order from proximal to distal. Superior thyroid artery. Superior thyroid artery supplies the thyroid gland and larynx. Lingual artery supplies the tongue and sublingual gland. Facial artery supplies the face and describes this artery by details also. Facial artery. The facial artery give rise to the following branch. This is the facial artery which follow tortuous course in the face. It give rise to the following arteries. Inferior labial artery, superior artery which supply the lips, and lateral nasal artery, and continue as angular artery. This is facial artery. Maxillary artery. You already described this artery in the infratemporal fossa. Also, we repeat it here again. Maxillary artery. The maxillary artery divided into three parts. First part, second part, and third part in relation to pterygoid muscle. The first part located proximal to the lateral pterygoid muscle. Second part superficial to the lateral pterygoid. The third part distal to the lateral pterygoid muscle. The first part give rise to the following arteries. Two arteries passes to the middle cranial fossa. Two arteries passes to the middle ear. One artery passes inferiorly to the mandible. Two arteries that pass to the ear include deep auricular artery and anterior tympanic artery. Two arteries that pass to the middle cranial fossa include middle meningeal artery and accessory meningeal artery. And the third artery that pass to the mandible, it is named inferior alveolar artery. So, deep auricular artery, from its name, it supplies the external acoustic meatus and the external tympanic membrane. So, it supplies the external ear. Anterior tympanic artery, this artery supply the internal aspect of tympanic membrane. Middle meningeal artery, this artery which pass through the foramen ovale. It passes through foramen spinosum to supply the meninges. Accessory meningeal artery enters the cranial foramen through the foramen ovale and supplies the meninges and also supplies the sphenoid bone. Inferior alveolar artery, this artery supply mainly the mandible and mandibular teeth. The second part give rise to artery that supply muscle of mastication. Here, the arteries which pass to supply the muscle of mastication, temporalis, buccinator, medial and lateral pterygoid muscles. The third part of the maxillary artery give rise to 6 arteries, which are artery to pterygoid canal, sphenopalatine artery. This is the sphenopalatine artery which pass to the nose. Descending palatine artery and continue as infraorbit artery, and also give posterior superior alveolar artery. These 6 arteries include artery pterygoid canal, sphenopalatine artery, pharyngeal artery, infraorbit artery, this is a continuation of the maxillary artery, posterior superior alveolar artery, and descending palatine artery. Posterior superior alveolar artery supplies the molar and premolar teeth. Descending palatine artery supplies the soft palate and hard palate. Sphenopalatine artery, this is the main artery to the nose. Pharyngeal artery supplies the nasopharynx. Infraorbit artery, this is a continuation which supply inferior oblique muscle in the eye and inferior rectus and continue in the face to supply the area, infraorbit area in the face, and also supplies the maxillary sinus. This is a summary of the maxillary artery. Maxillary artery is the one of two terminal branch of external carotid artery. It divided in relation to the lateral pterygoid muscle into three parts. First part, which located proximal to the muscle. Second part, which located superficial to muscle. Lateral part, which located distal to the lateral pterygoid muscle. The first part gives rise to deep auricular artery and anterior tympanic artery. Two artery passes to the ear. Two artery passes to the middle cranial fossa, include middle meningeal artery and accessory meningeal artery. And one artery passes to mandible, it is inferior alveolar artery. From the second part, give rise to the muscle of mastication. The third part give rise to posterior superior alveolar artery, infraorbit artery, descending palatine artery, pharyngeal artery, artery sphenopalatine artery. Okay? Is it clear? Okay, let's move to the second artery, subclavian artery. Again, arch of aorta give rise to, from the right to the left, brachiocephalic trunk. This brachiocephalic trunk divided into subclavian artery and common carotid artery. Right common carotid artery. And then, so the right subclavian artery is a branch from the brachiocephalic trunk, while the left subclavian artery is a direct branch from the arch of aorta. The subclavian artery divided into three parts in relation to the scalene anterior muscle. The first part located medial to the scalenus anterior muscle, the second part located posterior to the scalenus anterior muscle, the third part located lateral to the scalenus anterior muscle. The first part that located medial to the scalenus anterior muscle give rise to three branches, which are internal thoracic artery, thyrocervical trunk, vertebral artery. This one, which pass through the foramen transversum, known as vertebral artery. Vertebral artery is the artery that supplies the brain. Internal thoracic artery supplies the anterior thoracic wall. And thyrocervical trunk, from its name, thyrocervical trunk, divided into inferior thyroid artery. Inferior thyroid artery supplies the thyroid gland and larynx, and also divide into transverse cervical artery, which supplies the muscle in the lateral triangle of the neck, posterior triangle of the neck, and suprascapular artery. The suprascapular artery participate in the anastomosis around the scapula and supply supraspinatus and infraspinatus muscle. Again, the first part give rise to three arteries. This artery which ascend upward known as vertebral artery. This artery descend into the thorax is internal thoracic artery. The third artery known as thyrocervical trunk, from its name divided into inferior thyroid artery and two artery, transverse cervical artery and suprascapular artery. This is a branch of the first part. The branches from the second part include costocervical trunk. The second part, which is located posterior to the scalene anterior, give rise to costocervical trunk. This costocervical trunk divided into superior intercostal artery and deep cervical artery. Superior intercostal artery supplies the posterior part of the thoracic wall. Deep cervical artery which supply the deep cervical muscle. The third part, which located lateral to the scalene anterior, give rise to dorsal scapular artery. This dorsal scapular artery participate also in the anastomosis around the scapula, and supply rhomboid muscles and levator scapulae muscle. Again, this is subclavian artery. The subclavian artery divided by scalenus anterior muscle into three parts. First part located medial to the scalene anterior. Second part located posterior to the scalenus anterior. Third part located lateral to the scalenus anterior. The first part give rise to vertebral artery, internal thoracic artery, and thyrocervical trunk. This thyrocervical trunk give rise to the inferior thyroid artery, and this one transverse cervical, and this one suprascapular artery. The second part give rise to the costocervical trunk. This costocervical trunk, from its name, costo give rise to the superior intercostal artery. Cervical give rise to the deep cervical artery. The third part give only one branch known as dorsal scapular artery. Now we finished from the arteries of the neck. Let's move to the veins. As we mentioned before, the external carotid artery divided into two terminal branches, which are superficiotemporal and maxillary artery. And as you know, the artery accompanied by vein. So we have two veins known as superficiotemporal vein and maxillary vein. These two veins join each other to form retromandibular vein. This one is the retromandibular vein. It is formed by two veins, maxillary vein, and superficial temporal vein. This retromandibular vein divided into anterior division and posterior division. Again, the retromandibular vein divided into anterior division and posterior division. The anterior division joins the facial vein to form common facial vein. This common facial vein terminates into internal jugular vein. The posterior division of retromandibular vein joins the posterior auricular vein to form external jugular vein. This is the facial vein. The facial vein, it is formed by two veins at the angle of the eye, known as supraorbit and supratrochlear. The supraorbit and supratrochlear join each other to form the facial vein. This facial vein joins the anterior division of retromandibular vein to form common facial vein that terminate into internal jugular vein. External jugular vein. External jugular vein, it is formed near the angle of the mandible or just inferior to the lobule of the ear by two veins, posterior division of retromandibular vein and posterior auricular vein. These two veins join each other to form the external jugular vein. This external jugular vein terminates into subclavian vein. So, what are the tributaries of the external jugular vein? Tributaries mean vein terminate into this vein. Now, we say the artery has branch while the vein has tributaries. يعني الارتري بيديني branch لكن الترايبيوتريز بيستقبل veins بنسميها tributaries. طيب نحن بدنا نقول الترايبيوتريز بتاعت الاكسترنال jugular vein هي منو؟ The tributaries of external jugular vein include transverse cervical vein, suprascapular vein, and anterior jugular vein. Anterior jugular vein. This is the anterior jugular vein. The anterior jugular vein, it is formed by a small vein in the submental triangle known as submental vein. This submental vein join each other to form the anterior jugular vein. This anterior jugular vein terminate into external jugular vein. Internal jugular vein. Internal jugular vein, this is a continuation of the sigmoid sinuses at the jugular foramen. The internal jugular vein terminate by joining the subclavian vein to form brachiocephalic vein. As you know, the right and left brachiocephalic vein join each other to form the superior vena cava. The tributaries of the internal jugular vein include inferior petrosal sinuses, pharyngeal vein, facial vein, lingual vein, superior and middle thyroid vein. طيب هسه احنا عرفنا انه عندنا 3 jugular vein: anterior jugular vein, internal jugular vein, external jugular vein. Internal jugular vein ده جايين من البرين من جوا as a continuation of the sigmoid sinuses. يعني بيطلع من الsigmoid sinuses as a jugular foramen وبنسميه شنو؟ internal jugular vein. This internal jugular vein joins the subclavian vein to form brachiocephalic vein. طيب تاني عندنا منو؟ external jugular vein. External jugular vein, it is formed by posterior division of retromandibular vein and posterior auricular vein join each other to form external jugular vein, and this external jugular vein terminate into subclavian vein. The last one, anterior jugular vein. Anterior jugular vein is formed by submental vein and terminate into external jugular vein. I hope it was clear. That is all. Good luck and see you again in the CNS course, inshallah.